Okay. Hi, I'm Erica Voss, and I'm going to talk about this recent publication in JAMIA titled European Health Data and Evidence Network, or EHDEN for short. And we're going to be talking about learnings from building out a standardized international health data network. So, to give a little background, I think most people on the call will know what EHDEN is, but just in case, EHDEN is an IMI project in Europe. It is a 5-year project that started in November of 2018, and its goal was to address the current challenges in generating insights and evidence from real world clinical data at scale. And one of the ways that Eden went about addressing the challenges was helping data partners that had health data convert it to the OMOP common data model. And what they would do is they would have calls for data where data partners could apply to get financial resources as well as support to do that conversion. Well, when the COVID-19 pandemic started, Eden thought, hey, we need to have a call for data that's specifically targeting institutions that have some amount of COVID-19 data. And so the COVID-19 Rapid Collaboration Call was born. Now, one thing that's a little different about this data call than the other data calls is because we wanted to ensure that all these data partners made it to the end so that we had access to the data, and we wanted them to be able to do it in a timely fashion, we assembled the Eden COVID-19 Task Force. And this was a group of individuals who had some experience or lots of experience in designing ETLs as well as managing CDMs. And actually, a lot of the people on the task force are co-authors on this publication. And the idea is if we pair those people with the data partners, we should be able to help them move through the process a little bit better. Now, even though it was early in the pandemic, we were still excited that we had 75 applications and we were able to award 25 grants. And this represented over 11 different countries and over 67 million patients. On the right-hand side of this slide, you'll see all the different data partners that were awarded, and we just heard from one of those data partners in the previous presentation. Now, switching gears a little bit, in the book of Odyssey, in chapter 6, we talk about the best practices that we think one should go through or consider when they're performing an ETL. And we've come up with these best practices based on experience over the years. So as we've done more and more ETLs, we've learned and we've kind of tried to set out this is what we think you should do. But we've never measured this process. And so as we were starting the COVID-19 data call, we thought, hey, this is a great opportunity. Why don't we measure the ETL process and see if we can learn anything about this? Is there something we should be changing or thinking about differently when we do ETLs? So our approach was we were going to have all the data partners follow the current expected process that's laid out in Chapter 6. And the Eden Task Force was going to help guide and ensure that we were moving through all those steps. We were going to track each data partner in 3 different ways. We were going to just track general information as we were working with them. We were going to give surveys out at the beginning, middle, and end of the ETL. And we were going to perform data quality dashboard, both at the initial onset of having a CDM and then one at the end to review quality. But we also defined what does success look like? What does a successful data partner look like? So first, we wanted to see how many data partners did the complete ETL in under 365 days. And that's because when the data partners applied, that was essentially said, this is about when we want you to perform this in. Additionally, we wanted data partners to successfully participate in network research. And so all the data partners were offered up the COVID ASI study to participate in. Now, I know I talked about 25 data partners, but the rest of the results will be on 21 for various reasons of being able to include their data. So an example of information we gathered while we were tracking the ETL process. So one thing we did was just see how long do individual steps in the ETL process take. And we learned that step 4 and step 6 seem to take the longest. Step 4 is mapping source vocabulary codes, and step 6 is performing quality assessment and kind of going through that circle of quality to get to your CDM. We had our survey questions. So we asked questions like, what will be your primary role in this project? And so, for example, out of the 21 data partners, we had 20 data partners that had at least one person that self-identified as an informatician. We had 17 of the 21 data partners that had at least one person that self-identified as a computer scientist. And we learned things from like this question that we had a good amount of technical folks on individual teams. Now, for a success measure of these 21 data partners, 52% of them had their CDM under 365 days. 43% of them participated in the COVID-19 ASI study. And 33% of them had both a timely ETL and participated in the study. So, what were my takeaways from going through this work? I think first, we solidified that a lot of the things we thought were good practices in the ETL still hold. So things like having the right composition of a team is important. So if you're going to get started, you need certain types of individuals to ensure that you have all the correct experiences in order to get to a CDM. Also, unfortunately, I think mapping source vocabularies is still identified as something that's challenging and can take a lot of time. I will note that we did bring in a fair amount of data partners that were new to the OHDSI community, so we were getting exposed to vocabularies that we had not previously had exposure to. So we definitely saw the challenge in that. But one thing that I wanted to highlight is that we uncovered that there's importance in thinking about governance. And so, thinking about this and reflecting on it from my own experience in the U.S., working for a company that licenses data, when I license data, the license tells me what are the rules for using the data, and so by licensing it, I know what I can and cannot do with it. Also, it's my personal opinion that early on within OHDSI, a lot of the individual groups that we were working with were well acquainted with how to work with their data. So they knew what governance rules they had to think about. As in working with these 25 data partners, we had quite a few data partners that were really new to using their data for research and new to using their data in this way. And so we had more than one example where governance actually halted us in our place. So I think this was a critical finding, is that you need to think about these things up front because they essentially can stop you from moving forward. So as I finish my presentation, I reflect that maybe chapter 6 is pretty spot on, but we might want to add a few more things to it based on these findings. Thank you for your time.